Hey, good morning, Facebook. This is Jim Blythe, Veterans Impact Show here today. We're here for you. I have Dr. Dee Ashmore, PhD in neuroscience, and my brother Cedric White. We're going to be talking about your mental health, your physical health, and taking care of our veterans. So stay with me. We're going to be starting with the broadcast in just a second. Thank you for being on board. Share this. Take a look at YouTube. Here. Welcome to the Veterans Impact Show, where our motto is Charlie Mike. Continue the mission. I'm your host, Jim Blythe, U.S. Navy Vietnam veteran and certified senior advisor. Join me as we feature veterans who continue the mission of leadership and commitment in our communities after serving our great nation. Why, you never know who you're going to meet or where we're going to go. So welcome aboard. Happy New Year and a great day to you. I want to say a special thank you to DBTV Network for putting us on Amazon Fire and Roku, and we're going to have another special announcement in the next week or so. And to AUN Network out in Northern California, God bless you guys and keep California going in the right direction. Hey, I want to ask everybody, please subscribe to our YouTube channel, Veterans Impact Show, Facebook. Get the word out, because today this is an incredibly special program. And a special thank you to my company, Fairway Independent Mortgage. My MLS number is 311-548, and our corporate one is 2289. You want to know about senior care and financing and mortgage? We're the largest non-bank mortgage company in the nation. We're here for you across the nation. Now, it is my honor to introduce Dr. Dee Ashmore.
Well, thank you very much for having me, sir.
I got to tell you, Dee, I was so excited when I started learning about what you do, because as a lot of people know, and they've followed me, we've talked about health and wellness of veterans since we started this back in 2015. One of the most important things is PTS. That is something that the VA is focused on. Traumatic brain injury, mental health, all of these things are results of some of the things in trauma that have happened, as well as things in trauma that have happened in the civilian world. And as you know, we've talked about different procedures, different things to try and get veterans off of drugs and try and really help them. I was introduced to Dr. Ashmore a couple of months ago, and I was very skeptical until I went to her office and I started talking with veterans that were being treated. This is the most amazing thing I've seen in a long time. So, Dr. Ashmore, Dee, you are a Marine. So please tell us just a little bit about your Marine service in the JAG Corps so everybody understands that you are a veteran taking care of veterans.
Yes, sir. So I actually started off enlisted. I joined the Marine Corps right out of high school and was very fortunate, very blessed. Was offered a position to go to OCS shortly after Desert Storm, and I took advantage of it. Won't bore you with the details of how I thought it was just another school. Became a commissioned officer, and very fortunate and very blessed that the military put me through law school and finished out my time in JAG on the East Coast.
How fun. What, in Norfolk, in that area?
Norfolk, Virginia, NAB Little Creek,
Oh, man, yeah.
up and down the East Coast mostly.
So you are a Marine and a veteran. And then tell us quick about the story about your dad and what you were doing, because your JAG work led you into insurance
It did.
work.
It
So
did.
how did you learn all about that? And then all of a sudden you find out your dad is ill. Tell us that story.
Okay, so in 1996, I returned to Texas and took a civilian job at a law firm specializing in traumatic brain injury. Um, Also wanted to be back in Texas because of my father. He had been injured on the job, catastrophic injuries, left him in a wheelchair with an intrathecal morphine pump. And because of my job, I was introduced to many doctors in the civilian world that we used as experts in our cases. So, not to bore anyone with the details of workers' comp in the state of Texas, it became difficult in his claim. After 6 months, he wasn't getting better, and we had a lot of insurance disputes. I didn't know the first thing about it, administrative law at the time. I was just working in litigation. So I began talking to all my doctors and asking questions. What's going on with my dad? He's not getting any better. He goes from this individual working his entire life to a significant injury that just completely disabled him from any functioning capacity. So found what we called it back in the day reflex sympathetic dystrophy, manifested in the upper body, spread to the lower body. He became depressed secondary to the injuries, not being able to do anything. And I again started calling all the doctors that I knew. What's wrong with my dad? What can we do? How can we treat him? And found some technology. And ultimately, it took me 2 years because it's what I do now. I was very skeptical, like you were when you heard about what we do. It literally took me 2 years to send my dad down to treat with this doctor that invented this technology, and I could kick myself in the hiney for not doing anything sooner. Within 6 weeks, my dad was detoxed off the morphine pump. No pain medication, living, breathing, walking, talking human. No cane, no wheelchair. I loved it so much I started a
Back
clinic.
mobile. Okay, and
Complete
that's
mobility.
because of this technology.
Yes,
Off
sir.
the morphine pump, out of the wheelchair, not even using a cane and going. That's amazing. And now tell us about the technology because it's pretty amazing. Because Dr.
It is.
Rhodes has sent me a whole bunch of information
It
about
is.
this.
Dr. Rhodes is the inventor of this technology. It's an electrotherapy device. So again, I was very skeptical. Back in the day of TBI and litigation, mainstream medicine was not electronic medicine. Back in the day, burgeoning technology was pain management,
Which was drugs.
interventional pain management, oral medication, needles, knives, injections, infusions, things like that, even surgical intervention. And electronic medicine, just like I said, was not burgeoning technology or mainstream medicine. So that's why it took me 2 years to actually break down and send my dad down to do these treatments. And it is an electrotherapy device. It works on the body systemically to normalize underlying etiology. So
Now,
on the central nervous
one
system,
of the things I want to do is define what it is not. What is not is electric shock therapy.
it is absolutely not
Absolutely
elect
not.
shock. No,
It is not. And it is not. I mean, it is FDA approved.
absolutely, yes, sir.
So it's also been approved by the VA and the community health care.
Yes, so
So
we've
you're
been implementing this. So I did this for many years. In fact, this technology led to a complete change in my professional career. After getting my dad back, if you will, I'm adopted. I was an only child, always a daddy's girl, and found this technology. Got my dad back 100%. I loved it so much I started a clinic. Dr. Rhodes is a brilliant doctor. When I was calling him to try to find out about this technology, let me back up a little bit. I left the world of civil litigation and opened my own practice, Devil Dog Legal Support, and represented healthcare providers for medical dispute resolution, claim adjudication, things like that, to get devices like this approved for other providers. And that led me to going back to school to ultimately get a PhD in neuroscience so I could better understand and articulate what this machine does and how it works.
okay. Let me stop because I know some things about you. A PhD in neuroscience,
Yes, sir.
law degree.
Yes, sir.
You were also valedictorian of your high school class. You
Yes.
didn't know I knew that, did you?
No, I didn't.
And Cedric, one of the most frightening things to a sailor is a really, really smart Marine.
You see me getting nervous over here, right?
Yeah. So you have done so much research. I understood more about it because I had done so much work with Phoenix Theralase in the class 4 FDA approved medical laser. So I know the importance of FDA approval. But the insurance industry really kind of puts this into a second class position. So much of what you also were able to do is bring the awareness of what this does and how it helps and improve that situation with the insurance industry, correct?
Yes, sir. In fact, like I said, back in the 90s, oh, you know what? Did I just give away my age? Because I tell everyone I'm 27. Okay. If you don't do the math,
That's a Marine for you.
applicable mainstream medicine was not electronic technology. So I was literally pre-negotiating with insurance companies on this particular device for the doctors that we represented at the time. And because we did not have FDA clearance on this specific device, it was a prototype that the doctors, Dr. Rhodes and some other doctors were using in the day. So Dynatronics was the first manufacturer to pick up the device, and I worked with them for many years. We implemented case studies and research with doctors across the United States, got some publications with some of our world-renowned neurologists and neurosurgeons, American Journal of Pain Management, and things like that, and actually got the first FDA clearances back in 2001 for a clinical device and a home unit. Did that for many years, and it was a battle with insurance companies for many years, and we had to introduce the technology and talk about the efficacy. Electronic medicine has been around for years and years and years. It was just never considered mainstream medicine. It is more so today than ever before because we're learning that the opiates do not work. They
Well,
mask
it's-
symptoms and don't allow you to heal.
It's
Right.
the results. And I can speak to that myself
Yes, sir.
because I wanted to vet you. So I've gone to the VA, I've gotten into your program. So there's more aspects than just the machine.
Yes, sir.
So let's back up just a second. One of the things is you get people in a whole lot faster than you can in either mainstream medicine, in civilian world, or in the VA. If I call you and say, I want to get in, it's like bang, right off the bat.
Yes, sir. Well, we've incorporated a group practice, and I'm always bringing in additional providers with different subspecialties to take care of our people. I've opened this practice specifically for veterans. I employ a lot of veteran providers, both doctors, clinicians, therapists, counselors, and peer support. So anytime we see a backlog for any of our patients coming in, I'll bring more doctors into the group so we can accommodate that need.
I've met one of your doctors, Dr. John Townsend, really amazing guy. And the detail, when I sat down with him, the detail that he went with me, I'm like, where has this guy been? Nobody's ever asked me these questions before. And then, so you go through a process of intake, you meet with a doctor, a medical doctor,
Yes, sir.
then you do this testing. Tell us a little bit about the testing because I think that was pretty amazing.
Well, depending on everyone has different needs. So everyone comes to us with a different reason. So we do a medical intake on everyone. Some patients only want medication management. That's if that's all they're going to see us for, then we get them straight to psychiatric care to manage their medication. Some only want counseling. Some want to make changes. They're not sleeping. They have nightmares. They have very high anxiety and they want to make physiological changes so they can live a normal, productive life. So that's where the vector comes in, vector therapy. So the testing that you're talking about is for vector specifically, right?
Right.
Okay, because
Well,
we
not
do
only that,
psychological testing as well.
We're in the
The
CAP,
ANS and the neuro.
ANS, all of
Okay.
that was amazing.
Autonomic nervous system and neuro testing. So essentially what we're doing is looking to see where you are within your autonomic nervous system. You need to be in a peripheral balance. So some people are high parasympathetic, everybody's different. We need
Right.
to see where you are, get a baseline study. Do you have too much norepinephrine? Do you have too little serotonin? And I know you told me not to get too scientific. So we'll just talk about chemical balances in the brain. A lot of folks can't sleep. You have high anxiety. You can't shut your brain down at night. So you want to lower the chemical production of the norepinephrine. And if we can get you, promote a better quality of sleep in your body physiologically, you get to the deep REM cycle. Your body can only heal while at rest.
Well, not only that, but that with increased blood flow and with sleeping, you're more oxygenating the body. Now, that also has all kinds of side effects. You're going to feel better. you're going to be more active. Now, there's not any studies that really prove it, but for instance, you and I were talking about cancer,
Yes, sir.
that when you oxygenate the body and when the whole body feels better, that fights cancer.
Well, true. In science, no disease can live in an oxygen-enriched environment.
Yeah.
So same principles that were introduced with hyperbaric oxygen therapy. What we're doing is making physiological changes to increase the, again, not to talk too much about chemical, VIP, vasoactive intestinal polypeptides, or vasodilation,
I knew that
increased
one.
blood flow.
I knew that one, Doc. I say that I talk
You
about
got
that.
it. You got it. That's why I had to go back to school to learn about this stuff, because I couldn't even spell it at the time.
But let's simplify it. With your background in law, with your experience with the vector, then you're getting a degree in neuroscience. You have combined a bunch of protocols or modalities to come together where it's pain management without drugs, it's counseling that at the highest level of basically testing to understand what's going on in somebody's body. That's unheard of. And I'm not just talking about the VA. I'm talking about in my own.
Yeah.
You know, to find out that I had to have a heart stent in my heart, they had to stick a thing in, up to camera and to do that. It's not the same. You may catch something like that by doing this testing. You may catch a heart problem. You may catch a kidney problem. You may stop the migraines or stop the PTS. And this works without going into huge scientific about changing your body, realigning your body, correct?
Correct. It
Okay.
makes physiological changes within your central nervous system.
And that is amazing. Now, guys, let me tell you, I've been going through doing the vector treatment, and I have met some of the most amazing people in there being treated. Now, I'm going to make a statement. While I talk about how great this is, there are some people that it doesn't work 100%.
Absolutely.
Because
It's not a
everybody's-
panacea. Yeah. If anyone ever tells you they have something that can treat everyone, you probably need to run.
Yeah.
Yeah.
But this is effective for me. So it depends on your body. Everybody's body is different. That's one of the things that I don't like about prescribing narcotics, prescribing some of these opioids. That doesn't work on some people. And it has it has a horrible effect. So I'll tell you what, we're going to take a break in just a second. And Cedric and I are going to come back with Dr. D.D. Ashmore. We're going to talk more specifically and tell war stories. We want you to know there is a way to take care of pain management. There is a way to have improved health mentally, physically, and emotionally. I'm a living example, and we're going to talk about those people. So this is Jim Blythe with the Veterans Impact Show. We're here for you. Stay with us. Share this. This is important information. And we'll be right back. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Hey, welcome back to Veterans Impact Show. I'm Jim Blythe, and this is Cedric White, minister, marriage counselor, U.S. Navy veteran. And today, we're honored to have Dr. D.D. Ashmore, who is a Marine, who is also a neuroscientist, and who is the owner and founder of Symbios Integrative Healthcare. One of the things that it is a VA approved, it is a community care. So if somebody wants to get there, who is a veteran, so for you veterans, this is available through the VA. Now, we are in Dallas, but we're also in Sherman. We're in Tarrant County, Arlington.
Fort Worth.
But I think, I suspect that Dr. Ashmore is going to put the pedal to the metal because she likes to drive fast cars. And you're going to see this in other places in the United States as well. Fair
Yes, sir.
statement?
Yes, sir. We've actually been around a little bit, not just in Texas. So to back up a little bit, we started the first clinic in 2001. It was mostly commercial insurance. We were on Fox 4 News locally in Dallas. Um, and in 2008, I was introduced to the Intrepid Center down at Brooke Army Medical Center. And again, the skepticism was just like we had to begin with.
Exactly.
And the commander of Intrepid Center's like, okay, I've got some mental health patients. We've got a lot of phantom limb pain. Put your
Right.
money where your mouth is. You take care of these. You show me results, and then we'll talk. Within the first 2 weeks, we completely knocked out everyone they gave us that had phantom limb pain. When you start eradicating their pain, then some of the mental components go away too. The secondary depression, they can sleep, many things, many different positive manifestations. Um, I got my first DoD contract in 2008. So we've been in Cheyenne, Wyoming. We've been in Colorado, down in Denver and Cheyenne Mountain, Beaufort Naval Hospital. So it's been around other places. So when community care started, to go back to your specific
Right.
question, I was back in Texas, and I took a civilian job for the first 6 months I was back in Texas. Had lots of phone calls from many different folks that I worked with in either the VA world, Texas Veterans Commission, Vet Court, things like that. Hey, Dee Dee, you're back. Do you want to help? And, after I said no for 6 months, well, the same female colonel that got me involved at Brooke Army Medical Center, after she said a few stern words that we're not allowed to speak on the radio and told me what I was going to do.
Well, yes, because it's civilian world, but if we were on Armed Forces radio, they may allow it because you're a Marine. I'm
I
kidding.
promised you I'd keep it clean.
Yeah, well, remember, I am an ordained chaplain, and Cedric is a ordained minister, so we would want to help you with your language.
How many bad words have you really heard from me?
Very few. How many of
Okay.
you heard from me? Well, let's don't talk about that. Dee Dee,
That's a different show.
yeah.
So let me answer your question about community care. So I was actually, as a veteran, asked to go out and find specialty care providers when we were converting over from the PC3 network to community care. And unfortunately, it was right around the time of COVID too, so it was very difficult. So we opened our practice exclusively to veterans in 2019 for community care. I've been contracted with community care since 2019, and we exclusively take care of veterans. So we've grown in the Dallas office to Sherman and Fort Worth as well. And yes, anywhere there's a need, I try to get doctors on board to either buying through us or using this therapy, implementing this technology in their practices as well.
And one of the things is, let's now pull up and we'll show the website so you can go Symbios Integrative Health. If you'll take it down, you'll see some things. But it's pain management without needles and without drugs. That's pretty amazing.
We try to get the patients off the drugs. Like I
And
said, with my father, we were able to detox him completely off the morphine.
so, and you're not doing like an RFA, which is you're not using a laser to cut nerves. You're not harming the body in any way. What the vector does is basically just kind of realign the energy in your body, which most people don't
It
understand.
resets the sympathetic nervous system. So
Yeah.
essentially, it makes physiological changes within the hypothalamus. It normalizes neurochemical output. So increased vasodilation, which is oxygen enrichment at a cellular level. Again, no disease can live in an oxygen enriched environment. Concurrent polarity, it gets your blood flowing. If you've had problems from, let's say, neuropathy, diabetic neuropathy, for whatever problems, if you've had an injury, disease, injury, illness, anything that has secondary components that stops blood flow, it creates concurrent polarity. It is electronic medicine. It's basically tuning up your heart's rhythm, heart rate variability with your brain's activity. So again, the neurochemical outputs. It is completely non-invasive, and there are no negative side effects.
Yeah, I like that.
You can't hurt. You can't hurt anyone.
You can't hurt anybody. That so what you do, and if you can go to the website, there may be a picture there. That's a great picture right there. You sit in a chair. They put these things on your fingertips,
Electrodes.
electrodes on your fingertips, and you sit there for what, 20, 30, 40 minutes.
40 minutes.
40
minutes
minutes.
lower, 40 minutes upper.
Yeah. And it changes you. I'm a living example. Now,
But he hasn't stopped swearing.
so my wife just made a comment. I think one of the most amazing things, for instance, is I have a messed up left knee.
Mhm.
I was talking with Billy, Command Master Sergeant Billy, who
And he'll
is
be Command Sergeant Major.
Command Sergeant
Yes.
Major. Thank you. Thank
Yeah,
you.
please.
Okay. I've gotten to know this guy. So I tell you what, we got to go to commercial. When we come back, we're going to talk about specific injuries, how this has helped. We're going to talk specifically also about the counseling.
Okay.
The other things that Symbios does, it is an amazing cornucopia of medical things that you are doing to be able to save lives. And I got to tell you, Cedric, you're a marriage counselor. What would that do to a veteran family if you could alleviate the pain and be able to restore somebody to health? What would that do to them?
So often, veteran families suffer because there's a lack of things that they get to participate in.
Yeah.
And I think we'll talk about that when we come back.
All right. This is Jim Blythe with Cedric White and Dr. Dee Ashmore. We'll be right back after these words. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. I'm Jim Blythe, and again, Cedric White, U.S. Navy, and the great, the one and only, Dr. Dee Ashmore. And I can say that without exaggerating because what I have experienced with Symbios, and I happen to know you were valedictorian, your high school class. I mean, you know, wow. I barely got out of there with a B. Dee, we've talked about the vector and how amazing, but the vector can also be focused or isolated to specific parts of the body. Like you had them treat my knee specifically, okay? My knee pain has gone down by at least 50, 60%. We're talking about Billy, who now works for you, and he was a ranger. He was a paratrooper. He told me that his last jump, his left leg went into a hole that he didn't see. Messed it up pretty bad, didn't it?
It did.
And he could barely walk. And he came to you and he said to me, Jim, I can jog now. And in a few more months, I'll be able to run. It's restored his life.
It does. It can be life-changing. We've had so many patients with similar stories. And let me back up and tell you, so pain, when we were talking about your knee, remember, this started off as a therapeutic device for pain. So when we first started, we were going after FDA clearances for pain management. So it wasn't until 2012, Dr. Rhodes went back with another manufacturer, added some components called thermistors on the device to autonomously measure your heart rate variability so it could choose the right beat frequency for every individual instead of us playing around with the beat frequency. And I'm going to get back to Billy. I'm answering this question. So that's how it works on mental health as well. So it's tuning up using thermistors or biometric biofeedback components to autonomously sync up to your specific needs. So when we treat you as a whole, we're still doing the regular vector treatment, but going back to your knee, we go back to old school, pull some of our protocols. We're still running regular treatments on you, but we're going to add different electrodes specifically for your knee to target that injury.
Diane can tell you that I demonstrated to her a day or two ago that I could do a deep knee bend and come back up. Wow, I couldn't do that 2 months ago or a month ago before I started. The other thing is I'm sleeping. Now, let's talk about some of the other people because Billy is an amazing human being and he was Army, you know. What can I say?
Yeah.
Okay. Talking about Tyler, for instance, I'm sitting there and I'm talking to this guy and I say, you ought to be a movie actor. And he's really, you know, a neat guy. And I said, what brought you here? And he said, high anxiety. I couldn't sleep at night. I had all of these problems. And he's being treated. He said, now I sleep all night long.
Mhm.
Wow. And he said, my anxiety level has gone down. For a lot of veterans, that anxiety, is that tied to PTS? Is that part of?
It can be. It can be. Okay, so again, we say secondary to disease, injury, or illness. It could just be genes, high levels of norepinephrine or increased anxiety. Okay, so you have this fight or flight you can't turn off. And this machine resets the neurochemical output to help reduce that. And it gets you a better quality of sleep. So, some individuals say they sleep up to 4 hours or less than 4 hours uninterrupted. You never get to that deep REM cycle. It makes your body do what it's designed to do naturally. It will shut down your brain so you can get to sleep, to rest and restore and create the normal neurochemical outputs that you should have. So again, high anxiety, it gets them to sleep. Again, your body can only heal while at rest. You're getting a good quality of sleep, and it's going to lower your anxiety levels. I've had so many patients tell us they couldn't even get to our office daily to do a treatment because the drive would set them off.
Yeah.
Now they can drive. They don't want to kill anyone anymore.
Yeah, well,
Sleep,
driving
anxiety.
in any major city in the United States has become problematic, no doubt about it. That's enough to give you PTS anyway. And this works so well with the machine. Now, the other component of what you guys do is the counseling.
Yes, sir.
So tell me a little bit about Misty and the counseling and what's going on there and who is she?
Okay, so Dr. Misty Ely is also a Marine. She became a counselor after leaving the Marine Corps. And if you ever have her on, I'll let her tell her personal story.
We're going to do that.
Phenomenal woman. And later went back to get her doctorate. And so now it is Dr. Misty Ely, and she is our clinical director. She runs all of our counselors, and she has been phenomenal in orchestrating a fantastic team of counselors with different specialties. So, we would get patients that would come to us for counseling from community care, and they wanted a specific type of counseling. I'm a neuroscientist. So like, what is that? So I had to get somebody like Misty on board to take care of that and run that. But again, what we do, a symbiotic relationship. If I can get you sleeping better at night, if I can get you feeling better, if I can get you able to communicate with patients through the vector treatment, your counseling is much more effective if you can open up and you can speak and you can articulate and talk about your problems, right? So
Oh,
it
yeah.
is a multidisciplinary approach.
If you can focus, Cedric, you would agree with me too, because you do a lot of counseling,
Mhm.
that basically if you can't focus, you can have all the counseling in the world, but it ain't gonna going anywhere. Wouldn't you agree?
I agree 100%. As I'm listening to Dr. Ashmore talk and some of the things that we've dealt with a lot of the veterans, one of the biggest things is the fact that the pain can be so engaging, so intense that interferes with the other areas. If all I can think about is the pain just in my knee, the pain in my head, then I'm reluctant, or it's difficult for me to deal with the other personal issues, whether it's the relationship, the children. I become more irritable. But as I'm listening, I see, okay, if I can bring the pain issues down, now I can focus on other issues in my life. And then we don't have this constantly spiraling out of control, the emotions that go on in the family. I'm thinking about even myself, how often my wife wants to talk to me. And it's like, I want to hear you, but maybe my leg, or at times the migraines are so bad. Then so I was like, okay, doc, I'm ready to sign up. So it's it's huge. It's huge, Jim.
It really is, Dee Dee. And it's amazing, what you have done and put together in the counseling part of it. And as I said, what was amazing to me is I went in, met with Dr. John Townsend. Then I went through all of the electronic tests for my nervous system, my systems. I don't understand all of that. But I got to tell you, they're going to be able to tell me a whole lot more about my body than I know. And I already know, okay, I got some kidney problems. I got some prostate problems. I've got a knee problem. I've got a back problem. When you know what the problem is, you can do something about it.
You address it, you focus it. We call it hot symptoms.
Right.
Again, underlying systemic etiology. You can have PTSD, you can have an old TBI, you can have old, any form of old injury, okay? If it's unresolved or you have unresolved underlying systemic etiology, you need to figure out what that problem is. I'll give you an example. We had a patient that came through the treatment program and really got nowhere. He wasn't sleeping any better, wasn't feeling any better. He heard everybody in the treatment rooms talking about their success, and he was a little frustrated. Sat down, met with him, and in the first 10 minutes, he told me that he had MS. It was nowhere in his chart, not any of his VA
Wow.
records, not even with Dr. Townsend's report. And I said, "Did you bring this up to any provider?" "Well, no, I didn't think it was relevant." Underlying, it's neuropathic, neurogenic, right? Switched up his protocols, and within 3 days, he's sleeping through the night.
That's wonderful.
Dee Dee, that is amazing. Okay, so I'm going to ask you outside of the outline I put together. I called you 2 days ago because I had a call from Oklahoma about a man in Dallas who is basically suffering from dementia. And you made a point, and Diane, you made a point to me that dementia has been diagnosed as a diabetic type condition, which is blood flow and oxygenation to the brain. This machine could help significantly then with Alzheimer's and dementia, couldn't it?
I can tell you many, many stories of patients that have been referred to us for. I'll give you one example. A patient was referred to us for restless leg syndrome. We treated him for the restless leg syndrome, but we didn't know. His wife has to accompany him for every single visit
Mm-hmm.
because he couldn't even relay his own medical history. He had severe dementia, um, had reverted back to his native language, and wasn't even really speaking English anymore. We started treating him, multidisciplinary approach. She wanted to try the vector. We did so, and his cognitive skills um, were restored. He was speaking very clear English again. They were sleeping in the same bed again. She couldn't sleep with him because he was kicking her all night long. His pain was at a zero, and phenomenal success. In fact, they started sending us more and more dementia patients because of the success we've seen on that. If you think about it, vasodilation
Yeah.
is oxygen enrichment at a cellular level. And if you think about dementia or even Alzheimer's, the key amyloid protein buildup in the brain, if oxygen enrichment, if you can help clear some of this up with oxygen.
Jim,
It's
can I
yeah,
mention
please,
something just
Cedric.
real quick as I'm listening to Dr. Dee talk about some of these situations? My mind goes back to some of the veteran couples that we've dealt with and some of the particular issues that have come into our office. Quite often we hear issues where the spouse will say that all my veteran, most of the time it's husbands, but all of my veteran mate, all of they want to talk about is their situation and their medication. That's all our life consists of. It's almost like there's a different person living in our house because their life, the veteran's life, is totally surrounded around the issue that they're dealing with, the pain management and the medication, which then causes the side effects, right? Which so their entire life, and so there's no engagement. And as I'm listening here, I'm like, I got to go back to the office. There's some people that I need to inform about this situation because it may change not just the counseling aspect, but it'll change, relieve the pain, relieve the medication, the side effects, and all of those things, which will have a positive chain reaction. So this is outstanding for anyone who could engage in it and get involved in it.
And I want to say also, you have worked so well, and you worked with the VA healthcare system and with the community care and with what is it, TriStar, TRICARE, TRICARE,
Yeah.
Tricare and Tri-West.
TRICARE, and
Yeah.
TriWest. So this is a military, this is a veteran. Maybe someday in the future you'll go back into working with the insurance with the civilian world.
We get a lot of requests every single day to do so. We have veterans that come to us with family members, and I've got a family, I've got a friend, I've got someone that needs help. And I guess my motto is if I have an open chair, I'm going to take care of them regardless.
It's wonderful.
I want to say something real quick because the three of us, Cedric, Dee Dee, me, and my wife Diane, we have a passion about helping people.
Yes.
We have a passion about expanding. And one of the things the VA and the current administration is really pushing, because I met with the lady who is PAO for Vision 17. We mapped out the program for 2024, and one of their main things is mental health and PTS. And that's where in 2024, Cedric and I are going to be talking a lot about mental health. And so starting off, here we go. A procedure, a system that can help, counseling that can help, testing that can help. Because if you don't know what's wrong, I want to go back and say thank you for VA for embracing this. It is not what a lot of people. Now, in my business in reverse, I hear so many people say, well, a reverse mortgage does this, or reverse mortgage does that. And I go, no, that's not the case. A lot of people look at this and they go, well, you're just trying shock therapy. No, you're not doing that. Not at all.
Not at all.
Not at all. Matter of fact, I've used it and I've never felt a thing.
It's microcurrent. So it is electronic medicine. What we've done is taken a combination of Eastern medicine. They're far advanced in the meridians and specific points of what works on underlying, or what we call systemic etiology, and combine it with our advancements in Western technology utilizing electronic medicine. And honestly, the protocols are the magic. The pad placement, the electrode placement is the magic of how we can make those physiological changes. So like you said, the testing is very important. You may have a TBI, but you may have some underlying systemic etiology that's going to prohibit any resolution to those symptoms. That's what we target. So going back to the medication we were discussing a moment ago, let's say patients come to us, they have hypertension, many different manifestations, or they're on opiates, or they're on whatever psych meds they're on. Sometimes we're able to titrate or adjudicate that completely because, again, vasodilation, blood flow, if you have oxygen enrichment at a cellular level, your blood pressure is naturally going to fall back into within normal limits. If you're calm, if you're sleeping, things change. There's a different manifestation for everyone. Again, everyone's different. That's why we have medical supervision on everything we do. You keep mentioning Dr. Townsend. We have other doctors in the clinic as well. And I wanted to say a shout out to Dr. John Townsend. He has been with me since 2001, since the very first clinic we ever opened. He loves veteran healthcare, and veterans get the attention from Dr. Townsend that you're not going to be able to get at a VA level. The VA is so big and so overburdened. It wasn't designed to treat the capacity of veterans we have in this time. So I am so happy to be a community care provider, because the whole concept behind community care is to be able to find specialty care that's not available at the VA, or to get you in sooner.
Yeah, and my salute to our political leaders from both sides of the aisle that have pushed for this community care. And that was under the Mission Act, I believe.
Yes, sir. United States Mission
and
Act.
now under the PACT Act, there's a lot of things that the VA is doing. This is not your grandfather's VA.
That's right.
This is not at all. And community care is an amazing thing to be able to help people. And yes, there are mistakes, but let me tell you, it's easier to get in the VA, and it's easier for me to work with Dee Dee in community care than it is in my civilian. Now, I love my civilian doctors. I think they're great. I'm not changing them. I can use the VA and not lose my Medicare and not lose my contact with my civilian doctors. That is hugely important for some people like me who don't want to lose those people. So again, we're talking about Symbios, integrated healthcare. We're talking about pain management. Let's make it simple. Mental health and pain management at a level that nobody really has seen before. And let me tell you, I was skeptical. Dee Dee was skeptical. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. I got to tell you, I got run on the mouth because I'm excited about this because what it will do for people. And I'm sitting there in your clinic and I'm not watching TV. I'm not reading a book. I'm talking to other veterans and it's amazing. The lady veterans I've met, the lady that was Army for, I don't know, I think 17, 18 years, and she's being treated. And it's, this is an amazing process, Dee Dee, and more people need to know about it. So one of the things I want to ask is share this YouTube, share this Facebook, get out there and say there is a way other than opiates, drugs. There is a way other than Diane. What would could we have done if we'd had this for your mother and stopped the tremendous pain that she was in? What could we have done for my father? Well, he was 98, so he'd be 103 now, but it could help. It also can help. Hey, you know, there's another disease that a lot of veterans get called Parkinson's.
Yes, sir.
This could help a whole lot with that, won't it?
It has. I have seen some patients that come to us for other reasons that we treat, and they've had a lot of their Parkinson's related symptoms resolve. But I will tell you, in all honesty, Dr. Rhodes has done some phenomenal work. He has treated some patients, and I cannot remember their names, and we're not allowed to discuss their names anyway. But I will say he's had some celebrities come to him for Parkinson's related symptoms with phenomenal success.
Well, guys, I'm here to tell you.
And the sooner the better.
Yeah, the sooner the better. Now, the other thing I want to mention, because I have a bunch of experience with the Class 4 medical laser that Gary developed, which is the best in the world. It will do many of the things that you will do, but yours is total body. Theirs focuses, and it's being used by sports teams, Kansas City Chiefs, many others. You met Gary and seen his equipment. I got to tell you, when you start putting these various electronic procedures together, you're talking about a major change in somebody's health. And when you get rid of the pain and get rid of the narcotics, you're going to save a life. One of the biggest things in the veterans world we're talking about is stopping veteran suicide.
Mhm.
Cedric, Dee Dee, if you stop the pain, then the suicide won't gain.
It is truly the suicide comes from a loss of hope. When I lose hope, when I don't think there's an answer, when I don't think there's any relief, and quite often what we'll hear is, "I'm better off not being here. I'm not, I'm a weight on my family. I'm a problem to those around me." But things like this bring about hope. Things like this bring about change, and it makes all the difference in the world, Jim. It makes all the difference in the world.
All the difference in the world. Nathaniel, would you put up the website again, please, so people can find it? Dee Dee, tell everybody your website address. How do people find you?
It is www.symbiosccn.com.
And that's SYMBIOS. I think if you just put in SYMBIOS Integrative Health, it will also pull that up, correct? That's the way I'm getting it.
Maybe.
Yeah, hey, that's it. Yeah.
Don't give me the lion.
Hey, neuroscientists like me, we're not always the best with technology. What can I say? This is an amazing, amazing, amazing thing, and it can be combined with other things to provide health. It eliminates the knife, the needle, the drug.
Mm.
What more can we do? We want to save veterans' lives. So again, get with your VA. If you want to, sign up with the VA. Here is a reason that you can be treated. Sign up with the VA and get a referral. Dee Dee, you were a Marine. You are a Marine. I'm sorry. Very quickly, your daughter is going into the Marine Corps.
She is.
Yeah, that's going to be a
She
kick.
just turned 18 and she is ready to go.
What did you say to her? What would you say to others on it very quickly about the advantages of being part of either the Marine Corps or the Navy or the Army or the Coast Guard?
You know what? I will tell everyone, I believe wholeheartedly in the military service. Whatever branch you choose to go in, I believe it teaches our young generation discipline. There is in my opinion, a lack of discipline in the younger generation in this day and time.
Yes.
I love the regimentality. I love the discipline. I love what it teaches us, honor and respect. But I will also say, and I tell my daughter this all the time, it is what you make of it. You take that time and you make it work for you, because so many young kids just
It's what you
flounder.
get. What you put into it is what you get out of it.
Yes, sir.
That's right.
And you can't. That's the way life is. The ways we choose. What you put in is what you get out. I got to tell you, this has been a truly, truly great program. Again, please share this. It's fantastic of saving lives. And Cedric, I can't wait for you to go down there and be treated. Matter of fact, they've got one up in Sherman, and they've got one in Tarrant County as well, and soon to be other places. What are you going to say?
Can I add one thing? You were talking
Please.
about suicide. Suicide awareness and suicide prevention has been one of our biggest pushes with our patients that come in. We see patients of every walks of life. We see a lot of pain management, but the majority of what we see is mental health. I have one particular patient that came to us extremely skeptical, didn't want to try the vector therapy, didn't want to do counseling, didn't want to pursue anything really, didn't want medication management. He just came to us. He was very angry. And I'll just say someone else talked to him in the office. He decided to try vector therapy. He was a Navy veteran. And I will tell you, I had a very important meeting with some medical manufacturers and some FDA folks at the office, and CMS advisors at the office, and he was knocking on the door. I stepped out to go talk to him, and he was hugging me and crying. He admitted to purchasing a gun the day he came to us because he wanted to end his life. And he said we were a game changer, life changing for him, and he's back to a DoD contractor now.
That's a game changer. That's Symbios. I want to close with a prayer. Lord God, thank you so much for people like Dee Dee and Cedric, who not only believe in you so much, but show their faith by showing their love. Thank you, dear God, for putting a hedge of protection around our active duty military, our first responders who run into the fire instead of away from it. Thank you, God, for our veterans who are working like Dee Dee to bring this nation back together and find things that work. This will be one nation under God, indivisible, with liberty and justice for all, with your help. This is Veterans Impact Show. Amen.